Health Talk made simple by Aziz. In homes across the country, reaching for a painkiller is a common, almost reflexive response to discomfort. Headache, muscle soreness, fever. These medicines offer quick, effective relief. Many people take OTC drugs without a second thought, assuming availability equals safety. But medical evidence points to a silent risk: potential kidney damage. Not just from misuse or overdose, even normal long-term use can harm kidneys. This guide brings the issue into the light and explains the link between common painkillers and kidney health. Its purpose is awareness, not alarm. We'll explore how pain relievers that help acute pain can inadvertently harm kidneys. Kidneys are resilient and compensate for damage, so symptoms often come late. Knowing the risk early is your best prevention. We'll break down the science, identify who's most vulnerable, and outline practical steps to protect yourself and family. Knowledge is the first step to safer choices. The core message: prevention through education. We'll start with the risk, then the symptoms, and finish with clear, actionable advice. We'll cover the specific drugs, NSAIDs like ibuprofen and acetaminophen, and how each can affect kidney function. The goal is to make this simple and clear. Learn subtle signs of kidney distress and adopt safer habits to manage pain while protecting long-term health. Take this information to your doctor and take control of your health. To understand the risk, we must first understand the medicines themselves. The pain relievers most commonly associated with potential kidney issues fall into two primary categories. You can find them in any pharmacy. The first group is non-steroidal anti-inflammatory drugs, or NSAIDs. Ibuprofen, commonly sold as Advil or Motrin. Naproxen sodium. Aleve. Aspirin. These medications work by blocking enzymes called COX-1 and COX-2. That reduces the production of prostaglandins that cause pain, fever, inflammation. Their effectiveness in treating a wide range of ailments has made them a staple in medicine cabinets worldwide. The second major category is acetaminophen, also known as paracetamol, most famously sold as Tylenol. It is important to note that acetaminophen is not an NSAID. It works differently to relieve pain and reduce fever. Its mechanism is not fully understood, but it does not have the same strong anti-inflammatory effects as NSAIDs. While often considered a safer alternative for people with certain conditions, it carries its own risks, particularly for the liver when taken in high doses. Many combination products, such as those for colds and flu, contain acetaminophen, creating a risk of accidental overdose if a person takes multiple products without realizing they all contain the same active ingredient. Beyond these over-the-counter options, there are also prescription-strength painkillers. Stronger NSAIDs, opioids, higher doses magnify the potential risks to your body. Longer-term use magnifies the potential risks as well. People dealing with chronic pain conditions may be prescribed these medications for extended periods, making it imperative for them and their doctors to closely monitor for any adverse effects on organ function. Reading the active ingredients on every package is not just a suggestion, it is a critical safety practice that prevents you from unknowingly doubling up on a drug and increasing your risk of harm. Your kidneys are two bean-shaped organs, each about the size of a fist, located just below the rib cage on either side of your spine. Their role is far more complex than simply producing urine. Every day, your kidneys filter about 120 to 150 quarts of blood to remove waste products and extra fluid, which are then excreted. This filtration process is essential for maintaining a stable balance of body chemicals. The kidneys regulate your body's salt, potassium, acid, They produce hormones that affect the function of other organs. They stimulate red blood cell production and help control your blood pressure. They are the body's sophisticated, tireless purification system. Pain medications can disrupt this delicate system in several ways. The most common mechanism, especially with NSAIDs, is constriction of the blood vessels that supply the kidneys. NSAIDs work by blocking prostaglandins. Certain prostaglandins are vital for maintaining blood flow in the tiny filtering units, the glomeruli. Inhibiting these protective prostaglandins can significantly reduce blood flow to the kidneys. Without enough blood, kidneys can't filter waste effectively. That can cause a sudden decline in kidney function, acute kidney injury, AKI. It is important to differentiate between the two primary ways painkillers can harm the kidneys: acute injury, chronic disease; acute kidney injury, AKI. A sudden episode of kidney damage or failure happens within a few hours or a few days. This condition causes a buildup of waste products in your blood and makes it hard for your kidneys to keep the right balance of fluid in your body. A common cause of drug-induced AKI is reduced blood flow to the kidneys from NSAID use, especially in someone who is dehydrated or who has other risk factors. If AKI is caught early and the offending drug is stopped, kidney function can often return to normal or near normal, but reversible isn't harmless. Each AKI episode can shock the system and leave residual damage. Repeated AKI speeds progression to long-term damage. Preventing that first acute injury is critical. While anyone who misuses painkillers can be at risk, certain groups are significantly more vulnerable. Understanding if you fall into one of these categories is critical. The first and perhaps largest group is older adults. Our kidney function naturally declines with age. Older kidneys have less reserve. Even standard doses can be dangerous over 65. Pre-existing medical conditions increase risk. Chronic kidney disease, diabetes, high blood pressure, heart disease, liver disease. Hydration and fluid status matter. Dehydration concentrates blood and reduces volume. Causes: vomiting, diarrhea, intense exercise, or not drinking enough water. Medication combinations raise danger. NSAID plus diuretics. NSAID plus ACE inhibitors. This triple whammy can severely reduce kidney blood flow. Pattern of use matters. Chronic daily use or exceeding recommended doses over time leads to analgesic nephropathy. It's essential to use painkillers under healthcare guidance with kidney monitoring. One of the most challenging aspects of kidney damage is that it often develops silently in its early stages. The kidneys are so efficient at compensating for lost function that you may not feel anything is wrong until the problem is quite advanced. However, there are subtle clues and symptoms that can serve as early warning signs. One of the most telling signs is a change in your urination habits. This could mean urinating less frequently or in smaller amounts than usual. Conversely, you might find yourself needing to urinate more often, especially at night. Any change in the appearance of your urine, such as it becoming foamy, bubbly, or discolored, dark, tea-colored, or pink, warrants a conversation with your doctor. Physical symptoms can also begin to appear as the kidneys struggle to filter waste and balance fluids. Swelling, also known as edema, is a classic sign. You might notice puffiness in your face, especially around your eyes, in the morning, or swelling in your hands, feet, ankles, and legs. Persistent fatigue and weakness are common due to waste buildup and anemia. Uremia can cause loss of appetite, a metallic taste, nausea, and vomiting. Some feel itchy or experience brain fog. New or difficult to control high blood pressure or flank pain after taking a painkiller is a red flag. Stop the medication and seek medical advice promptly. Knowing the risks is only half the battle. The other half is taking concrete steps to protect yourself. The most important rule for safer painkiller use: lowest effective dose for the shortest possible duration. These meds are for short-term relief, not daily long-term use, unless a doctor says otherwise. Before taking a pill, ask, is it truly necessary? For minor aches, try non-drug options first: heating pad, cold pack, gentle stretching, rest, massage. Reading the label is non-negotiable. Check active ingredients to avoid double dosing. Cold and flu remedies often contain acetaminophen, NSAID. Never exceed the max daily dose. Follow the recommended time limit, usually no more than 10 days for pain. If pain persists past that, get a medical evaluation. Don't keep self-medicating. Stay well hydrated, especially when taking NSAIDs. Drinking water helps kidney blood flow and helps them flush waste and medications more efficiently. Be cautious mixing painkillers with alcohol. Acetaminophen plus alcohol is hard on the liver. If you're on medication, limit or avoid alcohol. Widespread misconceptions about over-the-counter medications can lead to dangerous usage patterns. It is crucial to separate fact from fiction to make truly informed decisions. One of the most pervasive myths is that over-the-counter means it's completely safe. OTC status simply means the medication has been deemed safe enough for public use without a prescription when used exactly as directed. This does not mean it is free of risks. These are powerful drugs that undergo the same rigorous FDA approval process as prescription medications. The potential for serious side effects, including liver damage, kidney damage, is very real, especially when the drug is taken in higher than recommended doses, for longer than advised, or by individuals with underlying health conditions. Another common myth is, if I feel fine, my kidneys must be fine. Chronic kidney disease is often called a silent killer. You can lose up to 90% of kidney function before severe symptoms. There's also a belief that acetaminophen is always the safer choice for kidneys. It is not without its own risks. Severe liver failure can lead to secondary kidney failure. High long-term use links to kidney decline. Safer does not mean risk-free. In summary, the common pain relievers that fill our medicine cabinets, they're valuable tools for managing acute pain and fever, but their use comes with a responsibility. We have seen how these medications, particularly NSAIDs, ibuprofen, naproxen, can harm the kidneys by reducing blood flow or causing direct tissue inflammation. Long-term heavy use can lead to a slow, silent deterioration of kidney function and may not show symptoms until significant and irreversible damage has occurred. This risk is not distributed equally. Substantially higher for older adults, diabetes, high blood pressure, existing kidney disease. The power to protect your kidneys lies in your hands. Always use the lowest effective dose for the shortest time necessary. Read every label. Avoid accidental overdoses from combination products. For chronic pain, move beyond OTC management. Work with a doctor to develop a safer long-term plan. This may include physical therapy, targeted treatments, or alternative medications. Stay hydrated. Limit alcohol. Ask your doctor or pharmacist if a medication is right for you. Recognize warning signs: changes in urination, swelling, persistent fatigue, nausea. Do not ignore these signals. Report them to your doctor promptly. Early intervention can prevent permanent damage, especially in acute kidney injury. If you like this video, please subscribe and share so others can benefit. Stay tuned for more videos about kidney failure. Thanks for listening. Health Talk made simple by Aziz.